Major General Dr. Consultant Sanjeev Munusinghe, the Secretary to the Ministry of Health, Dr. Palita Bekon, World Health Organization's Director General Special Envoy for COVID-19, participants, ladies and gentlemen, good morning to all of you. It is indeed my pleasure and honor to talk in this forum today on military leadership in pandemic response under national security perspective. Therefore, at the onset, I would like to thank the Sri Lanka College of Military Medicine for inviting me to the 5th annual academic conference today. National security can be defined as a condition where absolute freedom prevails for the citizenry to pursue their social, cultural, economic, and personal interest. As the Chief of Defence Staff and the Commander of the Sri Lanka Army, I have a vested interest in maintaining an environment free from fear of life, ancestry, and danger to the lives and the properties of the people of this country, Sri Lanka. The COVID-19 pandemic was a new mode of threat that erupted in late 2019, where not even the most developed countries in the world were ready to absorb it. Therefore, this pandemic held the entire world standstill at the beginning without having a clue on what to do. The highly infectious virus attached with the adverse health, social, cultural, and economic effects, clouded by lack of information and misinformation, posed a severe threat to the world's lives and normalcy. Thus, the pandemic escalated into a crisis sooner, and Sri Lanka was not immune to this context. At this backdrop, the imminent threat of the COVID-19 and its possible effects was seen well in advance by His Excellency the President Gotabaya Rajapaksa, the President of Sri Lanka, even before the first case was discovered in Sri Lanka. Accordingly, His Excellency the President appointed the National Action Committee for Preventing COVID-19 on 27th January 2020. The COVID-19 being declared a global pandemic with adverse social, political, and economic effects to any nation, followed by the report of the first case in Sri Lanka and its unprecedented growth, prompted the necessity of a national strategy against this deadly pandemic even in our country. Accordingly, the National Operations Center for Prevention of COVID-19 was established by His Excellency the President, entrusting me to spearhead its effective functioning. In this endeavor, His Excellency the President recognized that the military leadership would be capable of producing a coordinated national effort against the COVID-19 with all government and private sector holders to save Sri Lanka from this menace. Accordingly, I undertook the responsibility of coordination, collaboration, and recalibration of roles and the responsibilities of different agencies for this national effort. Leadership is believed to be among the most essential elements critical to success. In a crisis, it is inevitable that people come to confusing, anxious, and panicking situations where decision-making may go wrong. In contrast, military leadership has been designed to withstand cumbersome situations, bear pressure, tolerate failures, adaptable to changing conditions, and make sound judgments and also sound decisions. Conflict resolution is one of the most exceptional contributes that military leaders possess. Enriched by the experiences from beginning in the field and working with many political, social, cultural bodies in crisis, military leadership stands above all and it's adaptable to difficult, complex and also dynamic situations. Therefore, I believe that there is no other contender to provide leadership than the military leadership to face a crisis of this nature. And it's the rightful secret behind the success story in prevention of COVID-19 in Sri Lanka, even in contrast with the developed world. The military culture is unique. It is often characterized by mission-oriented actions that all members from top to bottom understand what to do and what outcome is required to create. This awareness is created by centralized planning and the decision-making process. This is very important for a campaign against pandemic like COVID-19. There was a necessity that all stakeholders needed to know each other, stakeholders' task, and what action each other would take so that duplications of the task, confusions, and discoordination are avoided. Accordingly, the National Operations Center for Prevention of COVID-19 assembled all stakeholders and fostered necessary procedural practices where all actions were discussed, analyzed, decided, and coordinated as usually done in any of our military campaigns. The military leadership craftily managed to take all stakeholders, including some pursuing vendetta, under one flag and made a tremendous coordinated effort to achieve the success. Anticipation and maintaining team readiness is one of the most important attributes of military leadership. The proactive and preemptive nature of actions is a usual phenomenon to the military leadership. When the number of affected persons started rapidly escalating and many clusters being appeared, it was swiftly understood that available healthcare facilities would not be sufficient for the demand. The Triforces ardently undertook this challenge and prepared, renovated, manned enough quarantine centers and health infrastructure facilities, including intermediate care centers, ICCs, without escalating the issue into a bigger crisis. Anticipating in advance, Sri Lanka Army manufactured more than 25,000 beds within 72 hours and opened many number of immediate care centers island-wide, including the conversion of an apparel factory with 1,400 beds at Siduwa, the largest immediate care center in the country, specially reserved for ladies. Similarly, on the instruction of His Excellency the President, the first private hospital to treat COVID-19 infected patients was also established by the Sri Lanka Army by converting a hotel to a hospital in Koggala. As the head of the National Operations Center for Prevention of COVID-19 and the Chief of Defence Staff, I was able to direct, instruct and supervise this military contribution for this effort than anyone else with the instruction of His Excellency the President. You can compare the situation with other regional countries and see how things went out of control with the rapid increase of infected persons and how Sri Lanka recovered from the danger with our anticipated actions. The crisis demands rapid decision making. The dynamic nature of COVID-19 often left information gaps. However, we needed to react quickly to prevent rapid spreading, threat to lives, and also for human suffering. The hardest call for crisis leaders is to move ahead knowing that they may have it wrong. Even the inherent uncertainty of the profession, military leadership always believes timely decision making based on reasonable assumptions and judgments is more effective than making decisions later after getting all information. At the sudden increase of COVID-19 cases, the health authorities were overburdened with its limited capacities to absorb the large influx, having no sustainable facilities even for evacuation. Thereby, the Sri Lanka Army had to improve naval system to evacuate the COVID-19 infected patients to the designated hospitals, converting available transport facilities to mobile vaccination ambulance service. Similarly, no system was in operation for the evacuation of first contacts until Sri Lanka Army spearheaded the process in consultation with public health inspectors, PHIs, around the clock, ensuring the evacuation of all first contacts to quarantine centers before dawn. Therein, the quarantine center system was created by all three services, and you all are the officers who manage these centers with utmost commitment. This is where the intuition of military leadership comes into play. As directed by His Excellency the President, I utilized all available military, health, police, public health and other assets to get the real information from the ground. In that, the military intelligence extensively for contact tracing, while the health authorities helped to ascertain possible medical emergencies. The police and public health authorities provided the ground information for the right decision making. Accordingly, we were able to isolate the infected persons and areas from the rest so that the spread of the virus could be controlled. In this aspect, sometimes we made reasonable assumptions to decide which areas to isolate and which areas to leave open. This proved to be very successful, and if we had not made timely decisions, the situation could have been very different by now. Military leaders are particular about detailed planning. They know that the operational environment is always uncertain and also it is changing. To prepare for war, military leaders put together planners with diverse backgrounds and expertise drawn from different organizations and agencies to have a comprehensive plan. The military leadership is aware that we need to change and encompass all possible dynamics in the plans. This was the same practice in the National Operations Center for Prevention of COVID-19. Before we take and disseminate any decision, all stakeholders were adequately briefed about the situation and also about the available information. Before any decision was taken, all the possibilities were carefully discussed and considered, and it was cross-checked for any mismatches. Then the task of each stakeholder was carefully decided and supported components were well defined. This gave a clear picture of what to do by each stakeholder, preventing misunderstanding and missing any critical requirements. The military leadership perceives that managing a crisis needs managing three levels. Strategic level, that is national priorities. Operation level, that is operation under each agency, and tactical level, that is action at the grassroots levels. This principle of mission command is the binding factor of the trinity of levels to one focused action. His Excellency the President and we adopted this well-proven principle for the national action against the COVID-19 with the guidance of His Excellency the President and the government. In this regard, stakeholders and experts of health, military, police, economic, disaster management, trade and other fields were assembled at the National Operations Center for Prevention of COVID-19 and empowered the recommendations and decision makers in their specific fields. The decisions were made based on national priorities. At the initial stage, the national priority was to contain the pandemic, prevent further spreading, and minimize the losses of lives. Thereafter, with the vaccine was introduced, the national priority was shifted to the vaccination as the permanent solution. Accordingly, action plans and programs were centrally decided with the patronage of all expertise and stakeholders under the close supervision and the guidance of His Excellency the President. Based on the requirement, grouping and regrouping of different stakeholders were done. Thereafter, the ground level was empowered to carry on their actions under clear-cut direction from the military leadership, allowing the freedom of action under their specific field. All these ground level actions were bound together by a centrally passed direction from the military leadership through the National Operations Center for Prevention of COVID-19 with all the time with the guidance under His Excellency the President. When the vaccine drive was introduced, the national priority was shifted to complete the vaccination of the population soon as possible. Accordingly, as directed by His Excellency the President, the healthcare assets, military medical assets and other national assets were successfully augmented to complete the vaccination drive. The military played a decisive role with the assistance of national health services to bring back the normalcy to the nation through a well-geared vaccination drive. Meanwhile, it confirmed our ability in vaccine rollout to all other ill-gotten parties in retribution. Even the community vaccination does not lie on our primary role. In conclusion, let me reiterate that the military leadership is capable and more effective of absorbing and shouldering national responsibility in any crisis. As a part of the national security, the military is capable of responding earliest, discharging its fullest capacity and assets in any national crisis. His Excellency, the President, was confident in military leadership, military capacity and military commitment in COVID-19 pandemic, where it was proved a highly successful campaign. It turned the dogma fabricated in the society claiming militarization as an evil to a most humane, capable and entrusted approach in salvaging the nation and its general public from deadly pandemic. I am proud to say, as a military leader, that I was able to do the justice to His Excellency President's choice to use military leadership in spearheading the national strategy against COVID-19, and it's you, the military medical professionals, are the pillars of that success. Starting from the evacuation of our student community in Wuhan up until the date, being actively contributing for the pandemic control effects, and I thank all of you. Last but not the least, let me thank the Sri Lanka College of Military Medicine for organizing this conference and inviting me for this forum. I wish this conference would foster extended discussions on military medicine under the COVID-19 pandemic response in Sri Lanka. I wish you the best of luck in all your future endeavors. Thank you and have a wonderful session ahead.